I'm Subhasish Sircar, the founder and CEO of Health Vectors. Today I'm going to talk about health vectors where we use evidence-based science, we use cognitive computing, machine learning, a lot of artificial intelligence to be able to take medical science and personal health information and provide guidance to individuals so that they can live healthy with certainty. So how big is this problem? Well, it's killing 38 million people every year, and that relates to roughly about 6 million deaths in India due to non-communicable chronic diseases like diabetes, hypertension, cardiovascular diseases. And why is this problem so big? It's big because there is lack of awareness and people exactly do not know what they need to do in order to avoid these diseases before they have any symptoms per se. And similarly, we are also helping doctors provide proper guidance through the use of artificial intelligence, which we gather from the collected data. And what I told you before is a big problem that is not just in India but worldwide, where people are waiting for diseases to happen. And these are diseases, as I said before, if you have any symptoms whatsoever, it's already too late. That means you have contracted the diseases, it cannot be reversed. Therefore, the only way in order to avoid these diseases is to be able to predict that you're going to have this problem and then do whatever you need to do so that the disease does not strike you. So, in a nutshell, what Health Vectors is doing is using data and predictive science to help save lives through the use of personal health analytics. So how exactly do we do this? Well, we collect clinical data and personal health data on the individuals and then send it through a data validation engine which is looking at spot checks as well as pattern checks in the data. And then once we have good validated data, it is going into a rules engine which has three components: the present, past and future information on the individual. The present profiles the individual's current state of affairs with their health. The past is what they have gone through, and the future is what is in store for them. Taking all these pieces of information, running it through a rules engine, it then produces recommendations. These recommendations are then validated or endorsed by a doctor, and once the doctors have endorsed it, then through the delivery mechanism, either an app or a web solution or a report, this solution is finally delivered to that individual. Let me give you an example. Well, in this case, this clinical data and personal health data has come into the engine. Now, this is what the engine is doing. It's saying it's a male with medium levels of cholesterol but very high BP, has both parents who are diabetic, sleeps well, doesn't exercise much. Well, you get the point. That's one leg of this rules engine. And what it does is then says an expert panel of doctors, if they were sitting in front of this data, this is what the automated medical advice is spewing out. Same thing is happening with diet plan advice. And then once the doctor endorses this, this becomes part of the delivery that we give to each individual, which is a hyper-personal solution. Interestingly, for each and every subject that we encounter, we are collecting a lot of structured data. For example, we are collecting the demographic information, the clinical information, the personal health information, disease risks, their health grades, their targets, recommendations, and also we are diligently following whether they are actually utilizing our solution, that is, they are engaging with it, and what the outcomes are. So, how are we doing when it comes to traction and scale up? Well, we have created a business model which is quite similar to SaaS models that we are so used to. It's called Health Analytics as a Service. And in the three verticals, corporates, hospitals and insurance companies, today we are roughly at 125,000 users, and we are rapidly increasing that user base to roughly about 1 million users when it comes to year 2017 in countries other than India, in Southeast Asia, Europe and US. So our revenue in the year 2017 is expected to be $2.5 million. All of this with just a 15-member team, but a very professional and experienced board that is guiding us. Thus far, we are angel funded and we are raising $3 million by April 2017. Our journey thus far has also been very rewarding. We have received a number of awards worldwide. The one that I'm most proud of is the most innovative healthcare analytics company in India, which we received from Asia's Graham Bell. And I can safely say that we are well on our path to touching 10 million lives by the year 2018. Thank you.